Hi, myself Ishfaq, and I'm the lecturer physical therapy in International Islamic University of Malaysia. Today I'll be giving a brief intro about manual therapy. Manual therapy has a long history within the profession of physical therapy, and physical therapists have greatly contributed to the current diversity in manual therapy approaches and techniques. Previously, mechanical explanations were put forward to explain the mechanism by which manual therapy interventions worked, but the recent research, the new research, reveals the intricate neurophysiological mechanisms which are responsible for the effects by manual therapy. And besides that, the psychological effects of providing hands-on examination and intervention also plays a role. Now, according to the International Federation of Orthopedic Manipulative Physical Therapists, manual therapy techniques are defined as any skilled hand movements which are intended to produce any of the effects like to improve tissue extensibility, to increase the range of motion of joint, to mobilize or manipulate soft tissues and joints, or to induce relaxation, to modulate pain and reduce soft tissue swelling. So any of the skill hand movements which produces any of these effects are referred to as manual therapy techniques. But according to the American Academy of Orthopedic Manual Physical Therapists, orthopedic manual physical therapy is defined as any hands-on treatment provided by physical therapists. Now, what are the therapeutic effects of manual therapy? There are physiological effects, that means positive placebo response. There are biomechanical and physical effects, that means facilitation and modeling of tissue and repair. So now psychological effects, pain, that means pain relief through gate mechanism, pain stimulation of pain gate mechanism, or muscle inhibition or reduction of nociceptive activity. Now, what are the techniques which are included from the physical therapy point of view as manual therapy techniques? So according to the definition, any hands-on technique which is performed by the physical therapist is referred to as manual therapy. So it can be any traction, massage, trigger point therapy. These all can be called as manual therapy techniques. But we have in physical therapy, we have certain techniques which are performed on the joints. For example, joint mobilization techniques, which may include um, Maitland's concept or Maitland's approach, Mulligan's concept, Carlton Bones techniques, and there are certain manual therapy techniques which are performed on the soft tissue, like active release techniques, myofascial release, um, trigger point release, and instrument assisted soft tissue mobilizations, Cirex techniques, and the other techniques, for example, Butler's neural mobilization or Shacklock's neurodynamics. These are all included in manual therapy techniques. So these all techniques are referred to as are manual therapy techniques from the physical therapy point of view. I will discuss a little about Maitland's concept of manipulative physical therapy also. The Maitland's concept, it emphasizes a specific way of thinking, uh, continuous evaluation and assessment, and art of manipulative physical therapy. So it emphasizes a specific way of thinking that I will say like clinical decision making. So it's the way of thinking and the continuous evaluation and assessment of the patient and the art of manipulative physiotherapy, which are the manipulative physical therapy techniques which are used on the patient or to treat that individual patient. Now this um, before going into the details of Maitland's approach or Maitland's concept, there are two types of movements: physiological movements and accessory movements. Physiological movements are those movements which can be achieved and performed actively by a person and can be analyzed for quality and symptom response. Now, there are certain movements which are associated with the physiological movement. These are known as accessory movements like spin, roll, glide, etc. Now, this Maitland's process or Maitland's concept, it is clinical decision-making process that is assessment-oriented, following the meticulous acquiring of data from patients' subjective and objective examination or assessment. The core elements of Maitland's approach or Maitland's concept are the central core, that is the patient-centered approach, the brick wall analogy, and science and art of assessment. Now, the central core or theme of the concept of Maitland is positive personal commitment to understand what the patient is enduring. Therefore, Maitland's concept is a patient-driven model, and it is inclusive and places the patient and their main problems at the center of everything. Uh, the body's capacity to give information about how patient is affected by these problems, that is by symptoms or activity limitation, is the key to planning, selection, and progression of manipulative physiotherapy intervention. The second core element of Maitland's concept is brick wall analogy. So that is the concept thinking. There is this symbolic permeable brick wall and brick wall theory put forward by Maitland. So what does it mean? According to the Maitland, he divides the knowledge into two bases. One is the theoretical base and another is the clinical base. Although they seem different, but they are interconnected. So the theoretical base is the knowledge about the anatomy, about the physiology, about the pathology of the structures, etc., and about the neurophysiology. Now, the clinical knowledge, he divides: one is theoretical part, and another is the clinical knowledge about the history, symptoms, signs, and all. So, but our clinical symptoms, our clinical skills are determined by our theoretical knowledge, by our theoretical knowledge base. The first requirement is to learn to think in two distinctly separate compartments, which he divides into the theoretical and clinical. Although they seem separate and are quite different, but they are interdependent. The second requirement is the clinician must know the history, the symptom, and the signs very clearly, and while keeping these at the forefront of thinking. The third requirement is the clinician is required to use words in particular ways. To speak or write in incorrect terms means that the thought process required to choose the words must also be incorrect. So For example, if the patient is having pain around the shoulder, so if we write or if we say that he is having pain in shoulder joint, so but the pain may not necessarily be coming from the shoulder joint, so we must use the appropriate words or particular words in order to describe the symptoms. Now the fourth requirement is the clinician is required to choose treatment techniques in relation to patient's signs and symptoms rather than diagnostic title. So a good clinician always addresses the patient's the core problem of the patient as well as the signs and the symptoms of the patient also. So, for example, a patient comes to us. He doesn't come because of what he is having. It is usually the symptoms which drive a patient to a clinician. So, if a patient is having some disc prolapse, but he's not having any symptoms, he will hardly see a clinician. So when we are treating the patient, we need to address the symptoms. So now the third core element of Maitland's concept is science and art of assessment. This is the cornerstone of Maitland's concept. It is the clinical proof of whether the treatment is working or not. Now we do assessment according to the Maitland. We need to do assessment continuously. We need to do assessment, first assessment, that means the assessment at the first consultation, we call that as analytical assessment. So this analytical assessment helps us to establish and test working hypothesis. So this analytical assessment helps us to formulate the hypothesis and what are the diagnoses. Then assessment must be done before the treatment also, pre-treatment assessment that analyzes the effect of comparable signs. Then the third, assessment and reassessment during and immediately after each treatment. That's when we are treating the patient, we need to communicate with the patient and we have to assess and reassess during the treatment also and at the end of the treatment session also. Progressive assessment, that means we need to assess the patient every 3 to 4 sessions. Then the retrospective assessment, that means assessing the patient after a break. For example, we treated a patient for 5 to 6 sessions and after that he took a break of 15 days and he comes back. At that time we need to assess the patient. And then the final analytical assessment. Now we need to do both subjective assessment as well as the objective assessment or physical assessment. So the aims of subjective assessment is to identify how the patient is affected by the disorder and to establish the extent of physical examination and desired effects of treatment based on SIN. What do you mean by SIN? It means severity, irritability and nature of the symptoms. And this subjective examination, it helps us to generate the hypothesis. Now assessment, this physical assessment. So the physical assessment, the primary aim is to find the comparable sign in disorders with pain. So what we mean by comparable sign, it is the combination of pain, stiffness and motor response which examiner discovers on physical examination and considers to be comparable with patients' symptoms and described in the subjective assessment. Now these comparable signs will frequently serve in reassessment procedures, and that's the aim of the physical examination, and we test the hypothesis generated in subjective examination. So as we know, the physical examination involves observation, functional demonstration, active movement testing, passive movement testing, etc. So I'll not go into the details of the assessment. Now, treatment techniques. Which treatment techniques we need to choose? It is based on the response to examination. So our treatment techniques, which treatment techniques we select, it is based on our assessment and examination. So we need to consider, we need to take into account the sins. What we mean by sins, it means severity. I stands for irritability and for the nature of the symptoms, and then stage, whether acute, chronic, or and the stability, whether they are getting better, worse, or they remain same. So we need to choose the techniques with some specific. In addition to some of these techniques, we may use some specific home exercise. Then the treatment by Maitland's technique. What Maitland says that assessment is the key to success. So assessment is more important. Technique is merely a tool. So assessment is the core of the Maitland's concept. So if the better assessment we do, the more skilled we are in the assessment and examination of the patient, the it is better. So assessment is the key to success, and he also says a technique is a brainchild of ingenuity. So there are no set of techniques, but basic techniques must include every possible movement combination. Now it can be the physiological movements. Our techniques may include accessory movements, purely accessory or purely physiological, or combination of physiological movement or combination of accessory movements or combination of physiologic and the accessory movements. Now the principles of technique. The technique is based on the passive movements that provoke or relieve patient symptoms based on SIN, the severity, irritability, and nature of the symptoms. Now, according to the Maitland, he grades his mobilization. There are 5 grades according to the Maitland. The grade 1 is small amplitude movements at the beginning of the range. Grade 2 is large amplitude movements at the beginning of the range. Grade 3 is large amplitude movements at the end of the range, and grade 4 are small amplitude movements at the end range, and grade 5 is high velocity thrust. Now the selection of a technique, it is based on SIN, as I said. The aspects of technique itself, whether we are using mobilization or manipulation, and it's our treatment techniques are based on the signs and the symptoms. Now I think I will conclude here. Thank you.